water.
Yep.
God damn it.
Yep.
Well, this sucks.
The plumbing problem. Gosh.
High note.
From not so fabulous Las Vegas, Nevada, this is Pod Therapy. Real people, real problems, and therapists. You can submit your questions anonymously at podtherapy.net or email us at podtherapyguys@gmail.com. Jacob's full of great news tonight. You want to kick my dog while you're here, too? And now, broadcasting from the churn, that guy's Dr. Jim Jobin. I'm Nick Tangeman. It's time for some Pod Therapy.
I think that there needs to be a show called, like, Pipe Therapy, and it just needs to be plumbers taking questions.
There's a plumbers podcast.
Yeah, if any
sure.
of our listeners are plumbers, man, I would listen to your show. There needs to be a podcast for that.
I mean, the answer to most things is call somebody that knows what they're doing.
Immediately. Yeah, as fast as you can.
You can check the Patreon this week. It's a pretty good Patreon week. Jim and Nick both had plumbing issues this week.
And we take you through it like a cold case.
Yeah.
You really get to... Each of our stories is presented as a case study. And Jacob is carefully working the problem, trying to figure out what caused it.
I'll give you a clue as to why Nick is upset with me. And that is, my answer is, you need to call your insurance company, buddy.
No, Jacob's answer for Nick was move.
That was one of my options that I gave.
You should probably now leave and never return.
It's a good week on Patreon. What's the Patreon address?
Run, Simba.
Patreon.com/therapy.
Yeah,
there you go. Check it out.
If you want to hear about our plumbing woes, patreon.com/therapy. Water, man, it just does it.
Don't fuck with it.
Do not, man. It's just the fastest way to break your shit. Public service announcement outside of the Patreon. Find the water shutoff valve at your house.
Know where it is.
Go get it now. Know where it is. Memorize that
and
location.
know how to turn it off.
Yeah,
because if you don't have an easy one,
yeah, I have a valve.
If you don't have an easy one, you might need a pair of pliers or something like that.
Figure it out. Get that tool. Put it nearby or in the
know where it
area.
is.
Know that, because by the time you need it, you're screwed.
Like if you have a water shutoff valve at the street, for instance.
Yes.
If you have like a table or like a coat rack or something by the front door, and you need a pair of pliers, have a pair of pliers sitting in the drawer in that thing.
Also,
so you can grab it on the way out.
Public service announcement: if there appears to be water flooding through some portion of your home, do not ignore that for 4 hours.
I didn't ignore it. I didn't know about it. I didn't know.
However, if you do see it, don't ignore it.
Didn't know.
If you ignore that water, your ethics may be questioned.
It's a tough day to be Tangeman.
Oh,
who would have guessed that in both of our horrible plumbing stories, it would have been you who took the nosedive on that one. That's a tough one, man. You're taking the L.
It's just, Nick,
I got out with a W.
I mean, yours isn't great either.
No, mine's not as great. Well, yeah, mine, but honestly, that was a rough one. I mean, yours
your
is
house,
rough.
Your house is not in the same condition that it was in pre-plumbing issue.
I don't need to burn mine down for the insurance money.
Right.
So, yeah, I'm in a better spot.
Yeah. I agree.
Patreon.com/therapy.
There's really no winner here.
Enjoy our pain.
That's my point.
There is no winning. Both just tales of woe.
I would say the plumbing industry is one.
Yeah, the plumbing industry is doing great.
I think they're doing okay.
Yeah. And
somebody's getting paid here.
These mitigation companies that come do damage control, they're going to get paid. Yeah. And it's a great plug for homeowner and rental insurance.
Yep.
Definitely check them out. Make sure you type in Pod Therapy at checkout. Patreon.com/therapy. Come find out all about our woes.
We don't even have a place to type in a coupon code.
I was referred by a podcast. We don't care.
Sir, this is a gas station.
All right, we got a couple of great letters for this show. First one comes from none other than Theraproducer Sarah Smith.
I think I know her.
I believe that you guys may be related. In this one's titled Trouble Going Deep in Therapy. Hello, I'm so glad I have you guys that I can bug with my mental health ruminating. I'm going on 2 years with my current therapist, and while I still feel like I'm getting value from going, I keep getting frustrated with myself because I keep hitting roadblocks. My therapist shared with me that every time we get close to the edge of something that seems really big/important, I completely shut down. They said it's like I keep opening new boxes to explore, but instead of going all the way through the box, I shove it off to the side of the room. I've expressed that I struggle deciding on what to focus on each session because there's so many things that seem important for me to cover. But when I try to dig further into a box, I get nothing. Nothing as in I just can't process further. Or suddenly the problem doesn't seem as bad. Believe me, the problems are still there and keep causing me a lot of distress in my life. I think I said something about not being good with closure, but we ran out of time to talk about it more, so now I'm left to stew over these thoughts for the next week. I'm so tired of being stuck. I'm tired of roadblocks. Is there anything I can do to help myself break through? I'm sorry if my thought stream was super long and doesn't make any sense. I feel like I can barely make sense of my life half the time. As always, thanks for everything. And no, you don't have to keep me anonymous if you read this one on air. Thanks for what you do. That was Sarah Smith.
Great news, Sarah. There is something you can do.
Yes.
Make sure you know where your water shutoff valve is.
Sarah, we cannot stress this enough.
Yeah.
You know what? Let's just go all plumbing on this show. Let's just skip the therapy stuff. Water damage matters.
Let's get into stuff we really know about.
Let's talk about
we've got hands-on, boots on the ground experience.
I don't care to talk about water damage anymore, to be honest with you.
Oh, Nick is just bummed.
He's just hurting.
I'm totally... Anyway, hi, Sarah.
Let me tell you the first thing. Know where that water shut up.
How long has Sarah been in therapy?
Producer? Oh, a couple of years. Yeah,
okay.
Sarah said she's been doing it for a couple of years.
Okay.
Yeah, has done good work. But yeah, hitting those roadblocks where you find yourself, and I get this, I think for a lot of us.
Oh, thank you.
There we
you,
go.
Jacob.
Jacob's making drinks up in here. Yeah, that's the right way to cope with today. I think that's correct.
Just knock that back.
You sip on that, buddy. You'll be all right.
No, don't sip on it. That is not the prescription.
Just want to shotgun one of those. You'll be fine. All right, so Sarah, a lot of pieces to this. So first off, your problem is something a lot of people, I think, bump into. This is a common thing.
Yeah, this is pretty normal. I think.
I was gonna say, this has to be just everyone in regular therapy.
Really. Well, that's why I asked how long, because everybody who's new, I know this happens to.
Right. Not sure, which boxes to open. I think for a lot of us, when we sit down, we usually in the very beginning have a presenting problem. We sit down and say, man, I've been feeling really keyed up. I got anxiety, or you know what? I'm just here because I need to kind of develop some insight or some areas that I know are getting in my own way. I'm self-sabotaging, or I know I've got relationship patterns I want to work through. So usually it starts there. But then, of course, you open up Pandora's box and we start to uncover lots of different bits and pieces of ourselves. And especially when we're becoming very self-aware and self-observant and self-evaluating, which is often the posture we take in therapy land, now suddenly we start overthinking and over-evaluating, and we find lots of these little rabbit trails that are going off in every direction. We're like, man, I noticed that in my dating history, I tend to do this. And your therapist is like, that's fascinating. Let's talk about that. And you start talking about that, and you get a few paragraphs in, and you kind of get a little bit of time under your belt with that, and you go, yeah. So anyway, I lost a lot of weight in high school, and I was having kind of an eating problem. Like, oh, okay, is that related? No, but you know what? Now that I think about it, that's really important too. And like, you just kind of like start hopping around, like I noticed I need a lot of like validation at work, and I've noticed that that's becoming a problem, and I'm kind of resenting my boss for not bringing things up, but maybe I'm wrong about that. And the therapist's like, okay, so that's an entire processing style. And the first thing I want to say about that, Sarah, is that that's not wrong. It's not wrong. And your therapist, I think, is correctly nudging you to say, hey, I think there's more to explore on some of these things. And I think that maybe there's a novelty or a freshness about realizing other things. And so we kind of chase those things into a new direction. I don't think that's wrong. I'm glad that your therapist is observing it. And I think that the only way to kind of overcome that pattern is to do what you and your therapist have begun to do, which is A, observe the tendency, B, hopefully the therapist and you are both doing a good job of kind of keeping a good memory of things that have been discussed in therapy, that we have those notes to come back to, and then kind of making it a conscious point to revisit topics in a routine kind of way. I'm fine with a carousel of topics that kind of perpetually get brought up. I'm fine with that. And in fact, sometimes I think that that's how it is. Like, you'll get on one topic and realize the drilling's good this day. Like, there's just something, there's content here, and there's a lot here to uncover. And then in other topics, the well is run dry. That honestly does happen. And that isn't always because you're poor at drilling deeper into that. Sometimes it's just not there. It's just not refilling right now. It's not valid in your life. It's not front burner. And so I think that's entirely okay. But I do think it needs to become a pattern in therapy that you're intentionally circling back to areas that have been left behind, not always just waiting for them to be front of mind or relevant again.
This is why and we kind of, to some degree, come from different worlds.
I come from the streets, urban, ragtag.
Oh yeah, everybody.
Me and the Jets.
Everybody
going down. That wasn't the song we sang on the streets.
Right.
Okay.
No.
3 years
This
of
is the song
jazz
we played
tap.
when we saw you coming.
Yeah.
Walking down. We don't mess.
But you come from more of a mental health background. I come from more of a substance use background.
Yes.
And one of the biggest differences is the use of a treatment plan.
Yeah.
Substance abuse treatment is very treatment plan based.
Right.
And that's why I've always liked it, is because it helps people stay on topic onto what we're trying to accomplish.
Right.
We're going to identify our 3 biggest problems. We're going to create goals for each one of those. And then for each one of those goals, we're going to create some objectives, which are action steps that you're going to take.
Mm-hmm.
And then we're going to create some interventions that your therapist is going to utilize. And it helps to kind of really focus in on what we're working on. I have always liked that approach. It's always been very helpful for the people I've worked with. But I don't think necessarily that this is your problem or your therapist's problem. I think for the most part, this just speaks to how complex we are as human beings.
Yes, that's exactly it. In fact, and again, I defer to the therapist on the ground. I always defer to the clinician who's in the case. But I would be curious if it's a problem at all. Because to say oh, I've explored this topic, and one of the things Sarah says is I reach this place where the problem doesn't seem as bad as I originally thought, or I've just run out of juice. I've run out of processing power on this, and I don't hear her saying interest. I hear her saying I've reached the end of it.
Yeah.
And there isn't you don't break through paper tape at the end of the therapy race. You don't reach this place where I did it. All the things are done now. What? That's not it. Sometimes that's what finishing a topic feels like, is this feels resolved for now. I feel like I've generated really productive self-awareness of my behaviors and history on this.
Self-awareness. I feel like you gain self-awareness and you gain insight and you gain some coping skills. So you're able to identify the problem. You're able to cope with it effectively.
Yeah.
But that it's not like you've solved the problem.
Right.
You've learned the skills. You found the water shutoff valve in your brain is what you've done.
Yeah. You don't have to dig deep into all the pipes.
Right.
Sometimes you just need to stop them from flooding in the downstairs bathroom and ruining everything in your life.
So once you've found that valve, you don't need to have the plumber there all the time.
Yeah.
See how I'm tying all this together?
That's
with
pretty
it.
Good. It's really majestic.
I'm doing really good.
You're really an artist. That's where this is going. It's just plumber and therapy.
You're definitely coping with something masterfully.
Yeah. Clearly. Why don't you have another sip on that? So another quick point for a lot of our therapists out there that are therapists or students or interns. We know a lot of folks listen to the show that come into the background. There's actually a psychotherapy practice, a theory, that is called Gestalt therapy, Gestalt. And Gestalt, thank you, originated by Fritz Perls. Gestalt therapy has to do with this concept that it isn't always necessary to do these exhaustive, deep Freudian dives into this endless well of being. Fritz Perls believed that problems bubble up. He imagined the mind and consciousness like this bubbling cauldron, and particular issues and topics will fill inside the cauldron as this bubble, and it will float to the surface. And as it ascends to the surface, it takes up more and more of the visible space at the surface of this cauldron. And that bubble then must be addressed. It must be popped. It must be attended to. And so Fritz would say, well, that might be what's happening here, Sarah, is that you have multiple areas of your reality, of your life, boxes, so to speak, and these are floating to the top of your consciousness appropriately. There's nothing wrong with that, and they are consuming your conscious thoughts and becoming this present reality that must be attended to. And I think Fritz would argue you and your therapist are essentially popping a hole in that bubble or attending to that. And then once the air is sort of let out of this bubble, it sort of descends back into the cauldron. It still exists, but for now, it's not a top-of-mind present reality. And Fritz Perls would argue that is what's called completing a gestalt. That's where the word comes from. It's a German word which has to do with completing a cycle. And so Fritz would argue you're doing therapy productively if you look at it from the gestalt point of view, that everything you're doing is actually quite productive. I would still, again, default to the clinician on the ground, and I would ask the therapist, are there areas that you feel I have evaded? Do you think I'm losing interest on some things, or do you think that I'm evading some things and failing to go deeper because I fear it? And if the therapist says, yeah, there's some ideas I have on that, then I'd be interested in where they want to guide you on that. But it could just be the case that, you're doing this process. It isn't always going to be this exhaustive deep dive where you hit bedrock and now you know to stop digging. It isn't always that clear.
Mm-hmm.
Find the water shut-off valve.
This is what we're trying to
say.
say.
In your mind.
Yeah.
It's just before you need it, because by the time you need it, you're done. It's one of those things every homeowner should know.
There's going to be a lawn chair in front of it.
Probably not a bad idea to look into a renter's insurance, too.
You want to go ahead and know, your policy.
Even if you own.
Just figure it out. Get it. He's so depressed.
I am. This sucks.
It's going to be okay, buddy.
I don't know what you thought I was going to say.
I wanted you to say, Nick, it'll be okay.
It's all fine.
It'll be okay.
Okay, in Jacob's defense, he gave you two strategies. One, abandon and run away and change your identity and fake your own death. And the other, call the insurance and work the problem.
And also, in fairness, I believe either strategy you take, it will be okay.
Yeah. It'll be fine. Yeah. We're going to take a quick break, and when we come back, we're going to talk about EFT tapping. You're listening to Pod Therapy.
Today's episode is brought to you by Robert Brownie, Junior Mintz, Kayla Lansbury, Crazy Banana Scoop, Malia, and Cindy Ash. Would you like to sponsor a show? Become a therapy producer at patreon.com/therapy. Today's trivia theme in honor of our therapy producers is candy.
Ooh. You have modeled that banana excellently, sir. That is well done.
Okay. In M&M candies, what color did the blue replace in 1995?
The blue replaced another color?
Yes, in 1995.
Is this a multiple choice?
Yes, it is.
Okay.
A, orange.
All right.
B, tan. C, maroon. Or D, purple. If you'd like to join the therapy producers and make the show possible, go to patreon.com/therapy and sign up. Again, that's patreon.com/therapy.
All right. I don't remember the last time I saw a tan M&M.
I think tan. There were tan M&Ms.
Okay. Tan feels likely, but purple feels strange. I don't know that I've seen purple M&Ms either. I know I've seen purple Skittles.
I think I think there was purple Skittles. I don't think there ever were purple M&Ms.
Yeah. So
maybe
it wouldn't have been replaced. Maybe it's not there, but it just never would have been replaced. So tan definitely
I believe
existed.
orange exists currently.
I think orange is still there.
Yeah.
So there's orange, tan, purple, and what?
Fuchsia.
Maroon.
Oh, wow. Maroon probably does exist. I feel like the dark red M&M is there.
I'm sticking with tan.
And then there's like a candy
I've
red.
planted my flag on the tan M&M.
I think you're right. I think it's going to be tan.
And it's got a W on it.
Yeah. Ooh.
That's not an M.
From one
Flip it
angle,
upside down.
That's a W.
That's a W.
Fly the W.
That's it.
I'm going to go with purple. Just to hedge one out there. I do think you're right. So, gentleman's tip of the cap.
Respect the game.
Respect game. All right, go ahead. What is the answer?
It is tan.
All right.
I do not remember tan M&Ms.
Yeah, there were tan M&Ms.
Yeah.
Wow.
See, I'm too young to have known that.
That's the problem.
Yeah.
You weren't born until
youthful
98,
exuberance.
right?
So, yeah, my youthful exuberance. Yeah.
Were there ever purple M&Ms?
No.
Okay.
Oh, so your entire theory was right on that.
Yeah.
And maroon, are you just calling the red M&Ms maroon?
I threw that in there.
Yeah.
I needed a fourth.
Yeah. I feel like there is a maroon.
I mean, they're red M&Ms.
What is
There's
maroon?
red.
Is maroon red?
It's red.
Brown?
It's dark.
Like
it's dark red.
Dark, yeah.
That's got to be in there.
I mean, there's
It's
a red.
There's going to be shades of it, man, because there's like the candy apple red, like the guy in the commercial.
What are you talking about? There's
There's just red M&Ms.
Yeah, there's like a dark red.
No.
No.
Is it just brown?
Yeah.
Okay.
There's yellow. Are you referring to yellow, maybe?
Yeah, I remember the yellow
The
guy.
dark red or
peanut.
yellow.
Yellow guy has a peanut in him.
That's it.
Yeah, which are gross.
And peanut M&Ms are great.
No.
And Billy West, I think, does the voice of the red
That's
M&M.
right.
That is
in the ads.
Yeah, I never connected that dot, but now that I hear it in my head, of course that's Billy West.
Any other M&M's factoids that need to be dropped
man, you're
here?
really crushing this.
No, that's it.
All right, favorite kind of M&Ms.
Oh, I thought you meant the color. For a second, I was like,
those are all
why would I care about the color?
No.
I mean, the plain old school M&Ms.
Okay.
That's probably my go-to.
Those peanut butter M&Ms are crap.
The peanut butter M&Ms, though, I was just about to say.
Yeah.
If you put a selection of M&Ms out,
yeah,
I'm either going for the plain, but I might fucking dive over a table.
Yeah.
To get to those peanut butter ones.
You could
Peanut
tell
butter's
me
the
there's
bomb.
a pack of peanut butter M&Ms inside of a dead body. I would eat my way in and get those goddamn M&Ms.
Here's what
That's
you
the
need to
most
do.
disturbing thing you've ever
All right.
said.
Theropods.
Listen, I've thought about it.
I need you to, as soon as I'm done describing
think
this,
about it.
as soon as I'm done describing this, I need you to pause this episode, go do this right now.
Okay.
Unless you have a peanut allergy, in which case do not do this.
Oh, it didn't stop Nick.
Get you a bag of peanut butter M&Ms and put those right next to your water shutoff valve in your house.
That way, on the worst
That
day
way,
of your life,
you'll know exactly. Because every day you're gonna think,
treat.
oh, I'm gonna go get those peanut butter M&Ms, and you're gonna think about where they are, and then for the rest of your life,
you'll
know exactly where that water shut-off valve is.
First thing you do when you move into a new house, you always go get you a ceremonial pack of peanut
You just
butter.
put them next to the shut-off valve, and when you move out, you eat them.
So I would say.
So by the way, I texted Laura
about the terrible news.
Yeah,
that you guys need to move and fake your own death.
I said, so bad news about the house. Jacob says the smell's not going to go away. We need to contact our renter's insurance. And I explained why.
Yeah.
And so her response was, so I was right.
Oh, that sounds about right.
That's so much worse.
Oh.
Yeah.
The only thing worse than having all the water
any
damage.
way this could be bad? Yeah. Let's also add Laura was right.
Yeah.
As she's like sassily swishing her wine and
So-
watching The Bachelor.
So I can't wait to get home.
Yeah. It's going to be a good night. You can sleep over if you want. My office is slightly saturated.
Can I
but
just
think
stay
you'll
here
be
tonight,
fine.
Jacob?
I have another coat of paint to put on some cabinet doors
Yeah, we
when
got
I get
shit to
home.
do.
I
Yeah.
feel like I need to go to the bar first, though.
Yeah, I think that's probably correct.
camaraderie. I feel
Yeah.
like I just need to
Yeah.
take you to the bar.
Yeah, I think that's probably right. Well, why don't we all just paint your cabinets tonight? None of us go home. It'll be fine. We just keep finding shit to do.
The problem is
fine.
that
yeah, just Nick can keep doing things.
I've got a big professional paint sprayer. So I mean, putting a second coat on it is going to take me 5 minutes.
Oh, there you go.
Because it's all I've built a paint booth in my workshop right now.
Yeah, it definitely looks suspiciously like a murder booth.
It'll
though.
take you 5 minutes to do by yourself or 50 minutes to do with us.
friends.
Right.
Yeah, that's right. Yeah, that's how that works. Yeah.
Or I could do it in 5 minutes incorrectly after I go to the bar.
That's right. I can do it 5 minutes and then redo it tomorrow.
Yes.
When I
Tomorrow,
I did one
I'll
side.
have 20 cabinet doors to sand and then repaint.
Yeah, either way,
my
this is going to be a fun night. EFT tapping. Hello, lovelies. I have recently been diagnosed with ADHD, currently unmediated, and am learning a lot more about my brain, which is mostly very helpful. I've seen several people in the neurodiversity community recommend EFT tapping as therapy. Side note for everybody, that's emotional focus tapping, I believe.
Thank you.
It seems to be recommended for
That's
such...
the stuff that the yogurt place, they charge by the ounce,
That
right?
is correct.
Okay.
Yeah. Those emotional focus toppings, I think, is what you were thinking of. Slightly different.
Oh.
Yeah.
Oh.
Yeah. It has to do with acupressure. It seems to be recommended for such a wide range of things, but little research has been done. I'm a skeptical person by nature, but also stressed and anxious. Have you guys heard of EFT or used it? Is there any harm in trying it myself?
Good. That's the question I was going to have.
Always a good one.
Yes.
I am very fidgety with a busy brain, so the thought of something meditative involving movement is appealing. Thank you from Scoop in a stupid ass way.
Oh, hey.
Pronouns are she and her. That's a good
All right. So non-fungible tokens, they're
NFTs. You really want to get those apes. That seems to be the cool thing.
I honestly don't know a whole lot about them.
They're not good for the environment.
Yeah, that's what I've heard too. But do you really own them? You know, somebody can just screenshot.
Do you really own anything?
That's deep. God, he's so existential. Can we get a philosopher Jacob jingle? That would be really cool. But I feel like it needs to have like some kind of...
He can't have two before I have one.
I know. Yeah. God, we have nothing.
We created the show.
I know.
We don't have one.
Well, it's funny because you and I are getting ready for Scoop Fest. And so we like, you reached out and you're like, hey man, you don't have any swag. Do you want some swag? I was like, yes, I do. And it's funny because I was going through the store with all my heart. The only thing I really wanted was the Jacob shirt, but I refused to wear it. I was like, I'm not doing it. Like, I'm not going to walk around just promote Jacob the entire fucking time.
We were ordering. I ordered a bunch of stickers that we could hand out to people during Scoop Fest.
Great.
And I looked long and hard at that Audio Guy life coaching.
I know. It's
I'm
just
like, no,
best
fuck him.
I know, right? No, we're finally promoting our show to real people. We're grifting off of him. We're not going to walk around advertising that he's the best thing on our show.
If he wants stickers, he knows where to get them.
That's right. Fuck that guy.
I don't know where to get them. Oh. What's
the
name of that site again? PodTherapy Bait Shop. There you go.
.com. Hey, if you're going to Scoop Fest, you better get down to Pod Therapy Bait Shop. Place your order. That way it arrives on time. We should probably answer this question, though, about EFT tapping.
So what is it?
All right, so literally, and I'm actually gonna mime this for you, Jacob. Right. So this will be great podcast theater. Tapping exercises literally are what it sounds like. So an example.
Oh, it's that. Okay, I know what you're talking about now.
Exactly that. Yes. So if you look it up online, you'll see people doing it. It looks very weird, and you see it, and you're like, "This kind of looks like bullshit." Mm-hmm. But essentially, it could be something as simple. So it has to do with these meridian points in your body. Okay, but in theory, there are these focal points that make sense to do this. It kind of blends with the theory of acupressure. But seriously, somebody will, do a breathing exercise, and I'm just taking my middle finger, and they'll, close their eyes or look into a fixed point in space, and they'll just sit there and flip off Jacob as I'm doing
Makes them feel better.
And then they will tap like the center of their forehead. And they'll do that a certain number of times, and then they will go to different meridian points in their body, like their chest and their knees and their hands and their palms, and they will just tap firmly into these particular locations. Mm-hmm. So it's an interesting theory. I have used it with some patients, but on kind of an elective basis. This is not a tool that I'll reach for and be like, oh my gosh, you have to do this.
The meridian points make it sound a little wooey.
It has some woo to it.
Yeah, that's what I was thinking.
It is it's woo-ish, okay? So in my opinion, it works, but not for the reason that it's whatever.
Not because you're hitting your chakra points.
No, which I don't even know that a lot of therapists are going to go that wooey on it. The acupressure stuff does work, but I think the deeper theory for why is something called the polyvagal theory. And that really does make sense to me.
Okay. That's eating more than one bagel.
Correct. Yes, it's having an open relationship with multiple bagels. Mm-hmm. Right. Yeah, okay. And that's what that is.
I'm with you. Go on.
Yeah, it definitely is sexual. So most people know about the sympathetic nervous system. We've talked about it on the show. It has to do with your anxiety response, the emergency. Then you have your parasympathetic nervous system, which is sort of standby mode. You have this other nervous system that goes throughout your body, which is the vagus nerve. It's not spelt like Las Vegas. It's Vagus. And so the polyvagal theory has to do with the way that our body and mind encounters this particular nervous system, which is very rooted in science. There's no woo to it. But what is interesting about the polyvagal system is that it does have a lot to do with stress, and it has a lot to do with touch. So whenever you go get like a massage, or you're doing yoga, or you're stretching, or you're breathing, all these things we know are kind of mental health adjacent. The polyvagal theory sort of unpacks why that is. And it does have to do with your heart rate, with endorphins, with certain biochemicals like cortisol that are actually being stimulated and released due to the polyvagal response. So there is some hard science behind this idea of like the body being pressurized or stimulated in certain ways and actually having a mental health outcome. So tapping does have, I think, a legitimate purpose to it. I have lots of people that have absolutely utilized different tapping techniques. Now, the EFT variety of tapping, which I believe is, oh no, it's like emotional freedom technique, I think is what they call it, emotional freedom technique. That's a bit proprietary. And I don't know that the EFT people own the entire theory of tapping. I've seen tapping show up in tons of varieties. Some people argue that it like goes back to Eastern medicine. So I do not think that the EFT guys have a monopoly on the theory. But yeah, if you look up tapping techniques, I think a lot of people use them. I think it works for a variety of reasons. One, I think is the polyvagal stimuli theory. So I do think that matters. Another reason I think it works is because you're doing this very routine mechanical action in a very focused and methodical way. And I think that accidentally has the byproduct of distracting you from your anxious thoughts or intrusive thoughts. And you're kind of encountering the body and you're limiting and focusing stimuli so that your brain is like channeling into only one sensor. So in the past, Nick and I have talked about grounding techniques as well. And we've talked about one called the 5 sense method, where essentially one by one, you only isolate one of your 5 senses and you try to dial into what your brain can perceive from only that sense. And that's essentially something that tapping's kind of doing, is that physical sensation.
It almost kind of reminds me of EMDR in a way.
Mm-hmm.
But it's different.
This is different.
So yeah. EMDR, like when I hear tapping, I think
you
of
immediately
like
think of
the patient are doing the tapping
your legs.
Right.
What's
doing
EMDR?
Something like that. Eye movement desensitization and reprocessing.
Okay.
Yeah. It's a therapeutic technique that we use for trauma specifically. And so and we've talked about it on the show once upon a time, but it's actually fascinating. This one's very rooted in science, though it actually comes off as very woo-y initially. So whenever you see a therapist doing EMDR therapy, there's going to be a component of talking through past trauma, but we're also going to do something like hold something up. Like right now I'm holding a Red Bull can in front of Jacob, and we will actually have you with your eyes track that can as we move it from a far right to a far left position. And we're going to be intentionally talking through some of your traumas while we're doing that. And what we're actually having you do is we're having your eyes follow laterally this can and cross the meridian plane. And what we're doing is something called bilateral stimulation in your brain. We're activating the left side of your brain and then the right side of your brain as your eyes are commanded to do different tasks. We can also do that with sensory touch, like these little vibrating paddles that stimulate one hand at a time, or as Nick was talking about, tapping your knees. All of these are bilaterally stimulating the brain, which we found when we couple that with a very specific method of reprocessing trauma, we actually get the end result of strong decreases in traumatic memory. So it's a really powerful set of techniques.
Okay.
So tapping, I think Nick's right. It's adjacent to that, and I think it follows
in the same neighborhood,
especially the bilateral stimulation.
Yeah, and it makes sense. I mean, because it's one of those things that, like, I've had this conversation before with people with, like, EMDR. Like you said, on the surface, it seems very wooey.
Oh, yeah. Somebody just tells you about EMDR, you're like, yeah, that's dumb. There's no way that's real. And you look into the science, you're like, son of a bitch.
But scientifically, it makes sense.
Yes.
Because what we're doing is it all has to do with the brain. So it's the way that you're stimulating different parts of the brain to process information.
Right.
And let me ask the question, if it doesn't work that way at all, if there's no chemical reaction, no body reaction to it at all.
No foundational theory.
Is there still some good that can be doing?
Exactly.
Yeah.
Is it? I mean, and I don't mean just psychosomatic, because I mean that's certainly an option.
Sure.
But is there, just the act, the pure act of having something to focus on there?
Yes.
Like, can that be part of it?
I think that's a big part of it. Honestly.
I mean, a bit. Yeah. I mean, there's so many things in science that we've figured out worked, and we don't know why.
Yeah.
Yeah.
I mean, that's the entire story behind how we figured out what neurotransmitters were.
Right.
It's completely by accident, and you just kind of stumbled upon it and like, oh, when these individuals have excess dopamine, they feel this way.
Okay.
Yeah.
Maybe dopamine does this. And so you just kind of stumbled across it.
Yep.
Oh, when these people have extra serotonin, they experience this.
Yes.
And
especially in psychology sciences, a lot of it's stranger than fiction. And like the placebo effect is incredibly powerful. Polyvagal theory for a long time.
Once someone explained to me that the placebo effect can work even when the person knows it's a placebo, my brain exploded.
Yeah. Oh, there's a magnificent video. If anybody ever wants to do a fun deep dive, it's a short video but it's a fun cartoon animation, and it's like the history or power of placebos. And they just rapidly show you a bunch of different effects that we know from placebos, like red placebos versus blue placebos will actually get different effects out of people. Bigger placebos outrank smaller placebos. Injectable placebos.
I was going to say, like, if you do an IV placebo, it's just
really
saline.
It's all the same stuff. It's sugar.
Yeah.
Sugar and saline.
So interesting.
Oh.
But yep, they all have different effects. So tapping might have an effect from that too. But
is there harm? Is there potential harm in this?
Yeah,
for
the
the writer
asks, is this going to hurt me? Gosh, I don't think so. I don't see any reality where, doing the tapping methods has a bad outcome. I mean, I think that they're really simple. It's not much more than literally what it sounds like. It's just kind of selectively taking these points of the body and just literally taking your own hand, an index finger, and just applying light pressure there in a thumping kind of pattern whenever you're feeling triggered or whenever you're advised to do it. So that's little more than just like what like a little kid might be pulling on their earlobe to comfort themselves, or any other action, like oral fixation, sucking on something, chewing gum, like it might be as simple as that. So I don't see anything harmful about it.
I'll tell you, I mean, I do acupuncture for back pain.
Do you really?
Yeah. I have a physical therapist that I work with, and she does acupuncture, and she does the electrified stuff. So she'll like put the needles into me, then hook electrodes up to them.
They hook you up to a car battery?
Pretty
You gotta
much.
pay extra for that.
Yeah.
How is it for you?
It works remarkably well.
Wow.
Because I didn't do it for years. The first time I did it, I was probably 38 years old.
Okay.
And because
About 15 years ago.
Correct.
Yeah.
I never bought into it. I never bought into the kind of wooiness of it and everything. And I still don't buy into the woo side of it.
The theories sound right.
But like,
it's nerves. They're being stimulated.
I don't know how it works. I don't have any idea how it works. But I also don't know how Tylenol works.
Right.
And Tylenol seems to do things too.
Yeah.
Right.
And so, Ryder, I would suggest, like, try it out. If it works for you, it sounds like there's kind of no harm possibility here, or no significant harm possibility here.
Gentle method.
And so try it out. If it works for you, who cares how it works?
Yeah, and anybody can just Google. I mean, if you want to, you can download EFT styles of tapping. But honestly, you can just type in tapping, therapy tapping, or psychology tapping, or anxiety tapping. And you'll get all sorts of printouts. They'll show you pictures.
I just Googled tapping therapy,
Yeah.
and you get a lot of results real fast.
Yeah, it's tons. And you just download them, print them, look at them. They're very simple. There's YouTube videos that even go to music, and like it's a guided meditation where the person will show you, and there's like a model demonstrating what to do. It's a very gentle method. And, again, I don't think it's the kind of thing you have to be fearful, like, oh, could this do something to me?
Yeah.
Well, no, nothing more than, tapping on your leg would do anything to you. It's literally just your body. It's an external thing and doesn't have a lot going on with anything.
Yeah.
Of course, I always defer to your therapist. If you're talking to a therapist and they're like, well, I have my own reasons for why I don't want you to play with that.
Cool.
Don't.
Listen to them. Don't listen to us.
It's a pretty innocuous thing. So that's so interesting, acupuncture. Does it hurt when they do it?
When they're just doing the needles, it doesn't hurt. Like you
Are they
feel
very
it.
fine needles?
They're super fine needles.
Okay.
They're very thin
Real
needles.
close to like a hypodermic.
Yeah.
Okay.
And so when she's putting those in, I tell you, it can be dangerous.
Yeah.
Because the area, especially where I get work done, the backs of your lungs are in that area. So if they go too deep, they can puncture a lung. And I am friends with someone that happened to 6 months ago.
Oh my God.
And it's not severe or anything.
But you don't want it to
But
happen.
it takes some physical therapy to get over it.
Wow.
And yeah, you really don't want it to happen. But when she hooks the electrodes up to it, sometimes it is, you definitely feel that.
Wow.
And sometimes it feels like a tickle, and sometimes it hurts and causes my muscles to seize like a sumbitch.
Oh, wow.
And but like that one, I can at least kind of understand it, because like if I've got super tense muscles in my back that's causing back pain,
Right.
and they go super tense, and and she keeps it on there. She keeps it electrified for 15, 20 seconds,
Okay.
which seems like an hour and a half while you're doing it.
Right. Yeah.
But she does that, and I'm probably wrong on the time. So whatever the real time is, and I'm not advocating for anyone to do this. Talk to a doctor. Talk to somebody who knows about it, because I don't know anything about it. But like I can at least understand that a little bit. I go, oh, this muscle got super tense,
right, and then releases.
and then as soon as that electricity stops, it does just turns to jello.
Do you feel relief?
Instant.
Yeah, it's got to be a big feel.
And like there have been times that I've gone in and gotten on the therapy whatever that table is called,
stretcher.
And I believe so.
Yeah.
Gurney, I think.
Gurney, yeah, that's it.
And she does it, and like I'll be having a hard time walking. I'll be in so much pain. I'll be having a difficult time walking. Lie down on that, and half an hour later, I'm not perfect.
You're not doing gymnastics.
But at the same time, like I can still play piano. I couldn't before, but I can play piano now.
Right.
But no, like it is. At least with the doctor who does it with me, and she is a doctor. I mean, she is an MD.
Oh wow.
And yeah, it's kind of amazing.
I like stuff. See, like we all know how I feel about woo. But honestly, a lot of things that at first do have a woo feel to them or definitely get exaggerated in their efficacy, when you drill into it, it does have good scientific theory. It has good foundational philosophy and can be done in a way. And usually the real professionals who really use it medicinally, they also don't exaggerate what it's going to do.
Right.
They're
And
not
this
like,
is the thing.
This is going to cure COVID. Like,
and so the reasons that I do it, I have an old back injury that I sustained. Oh boy, that was like not 2020, about 2000.
Okay.
So I mean, 22 years ago ish. I had a pretty severe back injury. I had a big set piece. I was under it, and a support piece broke, and it fell on me. It pancaked me. Hit me like right across the spine.
Oh,
and so because of that, I occasionally have back pain from it, especially if I'm working on stuff or like I'm in awkward positions and everything. And so that's the cause of my back pain.
Right.
So that's the thing is we know what the cause of my back pain is.
Right.
So we know that we are alleviating a symptom.
Right.
We know that we're not curing anything by doing
There's a theory
it.
of treatment. It's
Yes.
not just this catch-all. Oh,
Exactly.
yeah, no, it fixes everything.
Yeah.
And
this
hurting?
And this is something that she says. She's like, if I don't know what the cause of the pain is,
I won't do it.
I'm not doing this.
Yeah.
This is not my first go-to step. This is something that I do later on after everything else is set. And
I
after
like
everything
that
is
a medical
understood.
doctor, especially with that risk of like the lung thing. And
Yeah.
Anytime there's needles involved,
Yeah.
it's like I trust the doctor and that guy from Craigslist behind the Walmart.
Mm-hmm.
Yeah, that.
Or Herb knows what he's
Steve?
doing.
Yeah, Steve's great.
Oh,
Steve's
you have
real
Steve?
good.
Yeah, Steve, I
Affordable,
don't-
very
Oh,
affordable.
I've been going to Herb for years.
Oh, have you gone to Herb?
Yeah.
Yeah. I heard Herb got out of business though.
I mean, he's the OG.
yeah. Herb knows.
Herb's
but,
a piece of shit, and you can tell him I said that.
All right.
well, I wouldn't talk like that to Herb.
Well, Nick's not. You notice.
Last guy that talked like that to Herb got his entire downstairs flooded. We're going to take a quick break.
Laura was right about Herb.
Laura was always right about Herb. She knew. We're going to take a quick break, and when we come back, we are talking about long COVID and high anxiety. You're listening to Pod Therapy.
Today's episode is brought to you by Robert Brownie Jr. Mintz, Kayla Lansbury, Crazy Banana Scoop, Malia, and Cindy Ash. If you too want to become a therapy producer, go to patreon.com/therapy. Our second question on of our therapy producers is about candy as well.
All right.
What candy bar was named after a family's horse?
Oh, wow.
Is it A, Kit Kat, B, Twix, C, Mars, or D, Snickers?
Oh, God.
If you would like to join the therapy producers,
Solid
go to
possibilities there.
patreon.com/therapy.
All right, we can rule out Mars because that's a family.
That's a
We
family.
know the Mars people, so that's not it. Kit Kat, Twix, or Snickers. Those are all legit names. But I wonder, do we tend to see animals named Snickers now because of the candy?
Yes.
That feels like, so
No,
it's
definitely.
a cause-effect thing.
Yeah.
Because you hear Snickers, you go, oh, that's it. But then it's like, well, wait a minute.
No, we definitely hear that now because there's a candy bar called Snickers.
Yeah, Kit Kat sounds like a really good name for a horse. Because they make that sound when they're just
I'm
trotting.
between Kit Kat and Snickers.
Boots and cats and boots. And
What
cats
are you where are you leaning on this?
I really
Jobin?
feel like it's Kit Kat.
You're going Kit
I
Kat?
feel like it's Kit Kat.
I don't think it's Twix.
Twix seems hard to say.
I'm thinking that the name Twix is because they're the two candy bars inside the wrapper
Like
when you open up to it.
twins?
So I'm thinking betwixt.
Oh, wow.
I'm
Man,
thinking
we're
that.
giving a lot of credibility to these candy namers.
Yeah. Yeah, Mars, you have the Mars family.
Yeah. Twix.
I mean, I'll take Snickers.
I feel like we're on a good side on this one.
Yeah.
Either one of those could really be plausible.
When it's Mars and we both just eliminated Mars immediately,
Yeah.
it's going to be funny.
Yeah. I hope that's not it. then the family named themselves after the horse.
Yeah.
That'll be
Yeah,
it.
yeah.
That's it.
Paying homage. I'm going to go with Kit Kat. Final answer.
Okay.
And I'm going Snickers.
Answer is Snickers.
Some bitch.
Hey!
Ah, Snickers.
2 for 2.
2 for 2.
Gosh.
Familiar territory.
He don't celebrate in the end zone. He's been here before.
That's right.
Dang, man. So Snickers was a horse?
I guess so.
Guess so.
Wow. I was really kind of thinking it'd be Elmer.
Mm.
I think that would have been better.
It's the glue.
The glue. That would
Yeah.
have felt right. But Snickers it is. I feel like they should lead with that. There's a campaign right there. You know, Budweiser's not shy about their horses. That gets me to think about the beer. You know? The Snickers people need to be, they're burying the lead.
What
here.
type of horses do Budweiser use in their advertisements?
That is called an Anheuser-Busch horse. Is that not the one?
Nope.
Well, then
It's
I'm
a
all out.
Clydesdale.
Oh, yeah, those. Yeah. All right. They're the ones with the big fuzzy feet, right?
Yep.
They're very big.
Yeah.
The animals themselves are
Our
very,
local
very big.
Walmart was doing a deal over Christmas time where they were going to bring the horses. The Budweiser
Oh, yeah?
horses were going on tour.
My little town of 2,000 people where I'm from has a draft horse show
Okay.
every fall.
So they have to draw
and-
horses?
No, they get like it's a national draft horse show. Like they get
Oh, wow.
they
like
get
an
like
art
the
contest?
top teams in the country will come.
These are big fucking horses.
These are huge horses.
I'm assuming from your context clues, draft does not mean draw.
Correct.
No.
Draft horse is a big horse.
They're pulling
they're
something.
Clydesdales. They
Pulling
pull-
horses.
Like when you see the
Got it.
Wells Fargo wagon, you know, with all
Yeah.
the horses.
Those things.
Picture that.
Yeah.
But
Oxen horse.
Clydesdales, like
Dang.
they're
And monster horses.
huge.
Yeah, I believe
Yeah.
it. Good stuff.
Yeah.
Oh, do we have questions? Oh,
Yeah,
sorry. Okay,
let's
yeah,
do
yeah.
that.
Ahem. Hey guys, I'm writing with a couple of questions about adjusting to the new normal as a healthcare provider. I'm a physiotherapist in Canada, physical therapist to you guys. in the
Oh,
US.
so good day, mate.
That's right.
Thank you.
Yeah, top of the emergency, Canada. Who also I gotta start this over. I'm a physiotherapist in Canada, physical therapist in the US, who also treats vestibular and concussion patients. I've been doing this kind of work for 7 years, but since COVID, I've noticed a dramatic increase to the amount of mental health issues I'm encountering every day. The vestibular and concussion patients are typically the most psychologically taxing because those conditions have the greatest impact on their day-to-day lives. Of course, it's inevitable that a patient's physical well-being will have an impact on their mental health, and generally I feel comfortable supporting patients emotionally within the scope of my role. But lately, I've encountered everything from extreme anxiety, severe depression, and suicidal ideation, with plans to carry it out. Suddenly, it feels like everyone in my caseload is angry, demoralized, being effed around by the system, and I'm their most accessible resource to address their physical decline, their anger, and their sadness. I can't help but feel that this is not what I've signed up for, and that I don't have adequate training to handle patients who are in crisis. Of course, I encourage them to get support from an appropriate professional, but this is a challenge for all the usual reasons like funding and appointment availability. Of course, if I had the choice, I'd refer anyone whose mental health issues were beyond my scope, but that's just not the real world. I've reached out to my superiors for support, but this clearly isn't a priority for them, and they keep putting it off. I was wondering if you had any advice or resources that I could use to support patients when I feel out of my depth. I've also been struggling myself with the weight of these cases, and I'm finding it hard not to bring the sadness home with me. This has intensified as I've started treating patients with long COVID symptoms. I understand on an intellectual level that because I'm seeing vestibular long COVID patients, I am seeing one of the saddest, most extreme ends of the COVID spectrum. But watching the world open up still terrifies me, as I can't maintain a distance from the 12 people it's my job to touch every day. I struggle with my friends and family when my friends and family bring up COVID, and because they work from home, I find myself resenting their freedom and terrified that I'll get them sick. Any tips about coping with heavy subject matter like this would be much appreciated. Thanks, Matt.
This is a great question.
That is a good question.
I like this.
Luckily, there's an easy answer because there's an easy way to get them to just step away from you and solve their problems at the same time.
You know what? I'm
And
going
that is-
to let you go first.
And that is tell them to go find the water shut-off valve. That's going to do them some good.
Matt, we can't emphasize it enough. All right? Now, I assume in Canada they probably have these. Okay? They might be somewhere else. I don't know how the metric system works. So maybe check the top of your house. It could be there. You know, it could be on the roof.
Who can say?
Who can say? Not me. I don't live in Canada. They are higher up than us.
Nick, I feel like you had a different answer.
Slightly.
Okay.
Slightly, yeah.
Okay. You were going with that.
But I feel like we're kind of going the same direction.
Yeah, it's really the spirit is the same.
Yeah. I mean, okay, so first of all, let's separate, if we could, the suicidal ideation from everything else.
Yeah, good
because
point.
that
Get
is
that
a
out of
whole different thing. Obviously, I'm sure you've got protocols in your office for how you deal with situations like that. You're immediately going to assess that situation to the best of your ability,
Right.
looking at, means and all of that stuff. As Jim talks about before, what base they're on, using the bases example. Excuse me. Now, that being set aside, how do we deal with people in crisis? Because not everybody is a mental health professional, but we all these days are dealing with people with mental health crises. Yep. And there's no way of avoiding it. The thing that I always go back to, that I think, number one, give yourself a little bit of cut yourself a little slack. Don't set the bar so high. That you think that you have to be at a really high level, and you've got to give them something that's really profound, something that's really going to make them think. And you don't have to do any of that.
Yeah.
As my friend Brian always used to say, your fallback position is always a cheerleader.
That's right.
That is your backup, and anybody can do that. You don't need any mental health training. You just need to display empathy, and then just be supportive. And that's really basically it. And I don't want to oversimplify it, but that's kind of your starting point. Now, I think, sometimes we look really, we try to focus and jump right into solutions.
Yeah.
And we don't need to do that.
Right.
And then I can't tell you how many people that I think I've actually had a really profound effect on by not trying to solve the problem.
Yep.
By just being able to say, man, I'm sorry to hear that.
Right.
How are you doing?
Right.
Or to be able to, put yourself in that position and just give them permission to feel what they feel. Validation. Like, hey, if I was in your position, I don't think I'd be doing any better than you are.
Right.
I'd probably feel that way too. Just stuff like that can be very powerful.
It is profound. And really, man, there's so much to this letter that I just think is so important to unpack. So I want to circle back around to what Nick's saying and really come alongside and highlight some things and add to it. But I want to start by just observing for the general audience what Matt's going through. This is not a Canada reality. This is probably a global reality, but it's definitely a North American reality because it's definitely something happening in the USA too. And here's the problem. What we see throughout healthcare is that when people are experiencing health crises of any variety, they go and encounter the lowest hanging fruit. They encounter the first professional they can see. Usually that's a general practitioner, a GP, or a primary care doc. In this case, it's a physical therapist. What happens is that first encountering provider also discovers there's gonna be mental health stuff. As we talked about with Dr. Mike in episode 218, pain is an emotional experience. It is a visceral experience. It is a philosophical experience. It is a mental health experience. Just the aspect of pain is a big deal. Not to mention grappling with anxieties, depressions, comorbidities. People start to have all of these confluence of factors. And sadly, the first professional who shows up is usually a specialist or a generalist, but they almost never have mental health speciality. And of course, that splashes into their sandbox. So this has become a really big problem because those healthcare providers, just like Matt, often look around and go, I need backup. Like, I'm not trained for this. I didn't specialize in this. I'm a human. But other than that, I specialize in a very specific system of the body. I don't know what I should and shouldn't do with all this mental health stuff. And they quickly throw their hands up and go, can I please get some support? But then there are very few mental health providers in general to start there. And then there are even fewer mental health providers that are going to intersect with professionals like Matt. Whenever you're in an inpatient setting, it's very rare, in any medical setting really, that you're going to have a specialist like a mental health provider or a therapist on the floor anywhere. And if you do, they usually have another job. It's usually not to show up in these pinch points and be helpful with interventions. This is where there is this big, huge change. I hope this is happening in Canada, but it's definitely a big discussion happening in America. One of the biggest revolutions that we're talking about in healthcare is what's called integrated care. Integrated care is essentially the theory that we should always co-locate mental health with physical health, that we cannot silo these into different functions. They have to live together. So when you go to your primary clinic and they do a size up with the APRN or the physician's assistant or the MD, they should have therapists working at that clinic that can be tagged in as soon as that person says suicide. That doctor should say, great, let me go get Jim. And Jim should come hobbling in and go, hey, man, what's going on? Hey, this is Nick. Nick's a new patient. Nick was telling me just a little bit ago about some of the things he's going through. Nick, this is Jim. Jim's a therapist. He's one of the members of my team. I'm going to let you guys sit here and talk through this for a little bit, okay? And that frees up the doctors or the physical therapist in Matt's case to get back to the things they're really, really good at. And then it co-locates the specialist to get in there, tag in, and deal with the problem now. And that really helps because you can hear what Matt's talking about. It's hard when you're the only one that they can talk to. You're the first professional they're encountering, and they need to offload all of this stuff. And they overwhelm you because if you're Matt, you're like, God, I want to help you. I don't want to say that famous phrase that feels like a cop-out. I don't want to say, you should really go find a therapist. Because I feel like I'm dismissing you. I feel like I'm just walking away from your problem. And I don't want to do that because you're being vulnerable with me. You're telling me about all of the problems. And that's where guys like Matt are looking at this going, man, I really want to do something, which is totally why I get your point where you say, guys, what can I do? Are there any skills or any tools, like any techniques? I got to tell you, Matt, Nick's 100% right in this case. I don't want to give you a toolbox and have you trying to reach in your toolbox, handing out worksheets and techniques. And let me tell you about Gestalt therapy. Let me tell you about CBT. You don't have the time for it. You don't have the scope for it. And it's honestly not going to be effective in this environment because they're not even ready yet to get the kind of care. And you're not going to be able to do the long-term and sustainable treatments that they're going to need to ultimately get relief. But here's what you can do. It comes back to what Nick said. It's basically quantum psychology. Most folks have heard about quantum physics at this point. Most folks have heard about the double-blind experiment. Basically, one of the really interesting quirks of quantum physics is if you observe an experiment, you are changing the outcome merely by being a conscious observer of the physics. I know it's creepy. I know it sounds woo-woo, but it's absolute fact. The same effect happens in psychology. Merely by observing the reality of the human. Believe it or not, Matt, you are changing the outcomes of that person merely by being an active listener, a conscious observer, hearing them. Let them talk about their pain. Let them tell you what they're going through. Be inquisitive, make eye contact, use those basic attending skills of focusing squarely your shoulders at the subject, using your body to lean forward to demonstrate attentive listening skills, following along with all of your conscious observing skills, and then giving back some of the things they're telling you in sort of a summary way to demonstrate that you're with them, practicing empathy, saying that must feel like this, that must be so difficult. It must be so frustrating to have talked to 5 different people and not have an answer for this yet. I'm sorry that you're going through that. All of that is conscious observing. And by merely doing that, Matt, you are changing the outcome that that human will experience. Is it going to solve it, Matt? Well, no. That's why we exist, because there's part of the healthcare system that we are required to intervene in. But that's probably as much as we might ask you to do. And I think that that's actually a lot more than a lot of your colleagues are willing to do or capable of doing. The fact that you listen to this show, that you're interested in psychology, that you're trying to weave it into your work, man, I'll tell you, you could do so much good just by being a human observer and giving people permission to talk to you about it. And the authority you have in their life as a physical therapist is so profound, because for so many people, they've never sat with a healthcare professional of any type for longer than 5 minutes. And the fact that you can have that time to talk to them and absorb from them is probably the biggest encounter they'll have in healthcare, and one of the most meaningful ones the entire year. In the entire spectrum of care they get, just talking. And this is something that we as therapists get involved in all the time. A lot of times we're talking about things outside of our scope, because we're sitting with our patients and they're like, I've got this problem, this knee thing, I've got the stomach thing, and we're referring
or
out.
Financial problems.
Or financial problems,
I mean,
or all sorts of things, parenting stuff. And so their realities are often much bigger than mental health, especially physical health stuff. Like we were talking to Dr. Mike about chronic pain. And we don't necessarily offer solutions to that, but sometimes we're the only healthcare provider that will even listen for longer than 5 minutes. And that just being heard and exploring the idea, even if we don't have a solution in our pocket, Matt, very powerful and very therapeutic. It really brings healing to the person.
Now, wait, I'm a little confused, because you're saying that sometimes people talk about things that they don't necessarily know everything about?
I mean, it's almost unheard of.
People outside of this room.
Not me.
Certainly not in here. And certainly not someone on this microphone right over here.
Not any of these three guys. I feel like we confidently tell people, go find that water.
Get that water cut off. We can't overemphasize this, people.
I feel like if there's one takeaway, that's it. So, Nick, what do you think about what Matt says when he says the other half, where he says, look, I work with the scariest part of COVID, okay? Everybody else in the world, they get to move on from this. I'm the guy treating people at death's door, the really scary stuff, long COVID stuff, the really severe stuff. And now as the world is opening back up and people are starting to feel better, I'm feeling a lot of anxiety. I'm feeling a lot of nervousness. I don't want to infect other people. And I'm feeling some resentment from my friends and family that are just getting back to real life when I'm going to the front line every day and dealing with the scary stuff.
Yeah, I mean, it's almost, it's almost kind of like a post-traumatic stress disorder in a way.
Much.
I mean, a lot of similarities, and just like you've gone through this, once you go through something like that, then to just be able to turn it off and be like, oh, it's over now. Everything's done, even though we all know it's not. But just, we are returning to a somewhat normal way of life now. And that is incredibly difficult. And
Very.
I mean, a big piece of it, I think, is to be able to talk openly about that with other people that share that similarity.
Right.
That sense of community, I think, is very important. If you've got other doctors that are experiencing that same thing, and you can kind of just be able to talk to them about that, I think that can be very helpful, because it's not just that you guys get together and talk. It's the processing of it that becomes helpful in putting that trauma in a healthy place in the brain, as opposed to it just bouncing around like a BB in a boxcar. You're putting it someplace that it can be contained and it's healthy to go into that spot.
Very much so. And this is something, Matt, that so many healthcare providers often struggle with. In CBT, in cognitive behavioral therapy, one of the techniques we're trying to help people use to right-size their fear is trying to help them realize how rare that outcome actually is. And we usually tease them with the metaphor of horses and zebras. If you hear the clapping of hooves outside of your window and you can't see the animal making the noise, you should probably bet money on a horse. Even though zebras are real, they're super rare. And so probably not the most likely explanation. Well, the same thing in this reality, but here's the problem, Matt. You and I, we're healthcare providers, right? This is like a zookeeper. Zookeepers see zebras all the time. So you try to tell them it's not a zebra, they're like, it could be. You're like, well, no, zookeeper, it's still unlikely to be a zebra. And they're like, yeah, but I see a lot of zebras. I've seen more zebras today than horses, so forgive me, I think zebras, right? And so when you're a guy like Matt and you're seeing scary things all the time, you might accidentally wrong size the prevalence of that scary thing. And it will trigger some anxiousness inside of you to where you go out in the world and you still think there's zebras out there because you just came from a building filled with zebras, right? The rare stuff feels common. And it's hard to remind ourselves that it's rare.
That, and I think there's that other component too of like, it's hard to just go back to normal.
Right.
And to see other people doing
Been on
it.
high alert for 2 years.
Well, yeah, and to see other people doing it, it almost kind of you almost kind of become a little resentful.
Well,
of it,
and plus we were trained to be resentful for the 2 years because there's all the people that weren't taking it seriously. And you see them, like I've stopped wearing masks in buildings. Like I'll go into a restaurant. I went to a restaurant the other day for the first time ever. And I went inside of a store just today. I went to like a convenience store. Oh, just on the way here, I got a Red Bull. And I walk up to the store window, and the one over here on the corner by the Popeyes, it says, masks not required, but encouraged. Well, I didn't have a mask, and I thought, I am such a douchebag for walking in here without a mask. Like, it just made me mad at myself. But then I was like, Jim, you're one of the latest adopters, man. Like, it's not a big deal. Like, it's cool. But I just felt like really weird because for 2 years, I've been trained by the system now to resent that and to identify that as a douchebag, selfish action. And like, yeah, it takes a lot of like desensitizing to get back into a new normal.
Yeah.
I
don't think that's why you're a jerk.
Okay. Wow. Thanks, man.
Yeah.
Wait,
I'm here
I
for
think
you, buddy.
I may have misheard.
Nope. No, you didn't.
Okay. Heard it just as it is. Matt, hang in there, man. And just know you're not the only healthcare provider that is wrestling with this. You're not alone. But hey, tip of the cap to you, friend, up in Canada, just for being a person who's trying to weave in mental health.
I was going to say, I mean, just
So
being
cool of
concerned
you.
about this
Yes.
is a really nice thing.
Great to hear it, man. And listen, we're on the other side of the street.
Not
We hear
doing
about
it's
physical
not my
stuff.
problem.
That's
thing.
right.
This
Now
isn't,
pass
this
it
isn't my
along.
job. It's not my problem. You're concerned about it. And I bet that right there, you're doing a lot for your patients.
Yeah.
Don't
Absolutely.
underestimate the power of being a conscious observer. You have no idea the miracle that is in so many people's lives. It really changes things.
Yep.
So powerful stuff. Great questions today, guys. Man, we're doing great work. You guys feel successful at this? I feel successful at this. Tell you what I don't feel successful at, plumbing. I've learned my lesson there.
Yeah.
Immediately call for backup. We should announce that we're doing the March Madness tournament, but
We're already doing it.
by the time you
Yep.
hear this, it's deep. I drafted today. I picked my bracket.
Drafted.
I
Oh,
got
whatever.
bad news for you fellas.
Oh, yeah?
Unlike years past,
Uh-huh.
I did a little bit of research
Oh, no!
before filling out my bracket.
Remember
this
that
year.
one year that you just blindly did it and just walked
And did
through?
fine?
Yeah, you beat both of us.
I think
yeah.
I was like third place overall.
Yeah,
that
he was
year or
like
something
third
that.
overall.
Yeah. This
Crushed.
year I did like I'd say about 10 minutes of research,
Okay.
which is more than I have done since we've done this.
Have both of you guys picked?
Yes.
Yes.
Okay, so who do you have winning it all?
I've got the Wildcats. I've got Arizona.
You've got Arizona going all the
Uh-huh.
way. Okay, I went Zaga, so I felt
The Zags are that's
it's a
the
standard pick.
Yeah.
yeah. Nothing exciting about that. You go Iowa for the win.
Of course I did.
I
Did you really?
Fuck yes, I did.
I do have Iowa getting to the
follows
Final
his heart.
Four.
Yeah.
Do you
I've got
really?
Iowa losing to Arizona in the Final
Yeah.
Four.
Okay.
I went back and forth because I had Arizona too, and I was like Iowa, Arizona, but I know I say this every year, and last year I said it. I was like, this is the year they got Luka Garza. I think they're going to do
Lord.
great, but this year they got Keegan Murray, and I think they're going to do.
Iowa is strong.
Iowa
Iowa looks
kicking
in,
ass.
in my little bit of research.
yeah.
And because I'll tell you, you guys have been around most of the college basketball games that I have seen.
Yeah.
Because they've been on replay in the bar that we occasionally go to after we
That's
record
true.
this.
Yeah.
That's the only college basketball I've seen
About
all
as
year.
much
Yeah.
data as we have too.
Yeah.
Okay.
And, but my little bit of research, man, Iowa looks strong.
No, I've been
Yeah.
watching. I've been
If
watching
they win,
them all year.
it won't be crazy.
No,
It will not be a fluke if they win it.
when Iowa is on, they are unstoppable.
Yes.
They are nailing threes from half court.
Right.
Like it's just insane.
There's one team, it's a pretty highly ranked team. I forget who it is now, but I picked against them in the first round. They're playing, it's like I think it was a number 3 seed versus, what would that be, a 13 seed?
no, there are 5 seeds. They
Yeah.
play
No, this wasn't
12.
Iowa.
Oh,
But it was another team. I forget who it was now, but I picked against them in the first round.
You picked an upset.
I picked an upset. I picked a big upset in the first round just because the team they're playing against, all they do is hit 3-pointers.
Yeah.
And this number 3 seed, all they do is miss 3-pointers.
Wow.
They're like 20% from
This
3
is your
points.
research where you're like, all right.
I was
here
like,
we go.
I
The
know
long ball's gonna win it.
I have a little bit of knowledge here
Yeah.
that has probably led me very far astray.
That's a bold upset call. You're talking a 3 seed taking a dump?
I believe I've got 2 3 seeds losing in the first round.
Ooh, I'm excited for some sushi. That sounds fantastic.
But neither of them go past the second round.
okay,
Yeah,
nothing
yeah.
too
So
crazy.
they're not gonna damage me too badly if they do if the chalk wins.
Yeah.
So yeah, basically, I'm very confident that I'm going to win.
All right. I
also went ahead and clicked on the button that entered me into the big
I did
overall
that
tournament,
too, just in case.
and so I assume that I will have the best bracket in the country.
I believe you get a Toyota Tacoma if you win.
I think
as well.
I do. I think that's what I'll be getting.
Yeah. I did that too, but I'm in 3 different pools, and I did it on the first one that I filled out, which I think was the Hay Scoops one.
Okay.
So I didn't
that's
feel
your
official national bracket.
Yeah, and I didn't really feel great about that one.
Okay.
So
I filled out 3 brackets. Same thing. I did this show. I did Hay Scoops, and then the national one.
Yeah.
And they are 3 identical brackets.
That a boy. Way to go all in.
I'm very confident in my bracket.
Nothing wrong with that strategy.
Yep.
Nothing wrong.
I know that's the best bracket.
Ain't broke, don't fix it.
I know it's
That's
64
right.
for 64.
Of course.
And I probably got the tiebreaker.
Of course.
In
Nailed
the
the
finals.
points.
I nailed
Yeah.
the point spread.
Nailed
Most
the points.
likely.
Yeah. No doubt in his mind.
I believe my sister and I both did Iowa all the way.
Go for it. I remember one year I picked
They're
UNLV because it
Yeah.
was like, why not?
I did pick. I picked LSU to win in the first round.
LSU looks good.
Oh, they play Iowa State. I think.
I believe
don't
they do.
I have
which
LSU
I
going.
don't really think that they'll win because
I have
LSU also just fired their head coach and their associate head
It's
coach.
not a good sign.
This week.
That is not a good sign.
Yeah.
Coming into March Madness? Well, we're recording
I think
this, by the way,
seven
March
NCAA
15th.
violations against specifically that head coach or the associate head coach
Ooh,
at
that's
LSU,
rough.
and he was already kind of on probation
Oh, that's not good.
for the same thing anyway.
That is
And so LSU was like, "Nope, you're out."
Wow, good for them for having standard. Just FYI, we're recording this on March 15th. If you have joined us at patreon.com/therapy since this date, we will catch you in a future episode to make sure we triumphantly announce your presence.
Thank you.
But still grateful for you. So that's always a nice thing to have. And as you're hearing this, I don't even know when this airs, but later.
Yeah, true. Well, wait, or is it before?
Sooner.
Is it before
time continuum
tonight
stuff.
or
I was
later?
talking about quantum physics, man. I don't know what the rules are.
Whenever
This
you're hearing
comes out
this-
on the 24th.
Whenever you're hearing this, Nick is probably floating somewhere
in his indoor pool.
and just weeping.
Yeah.
He's floating on a boat in a river made of his own tears.
He's got a swan floaty in his indoor living room pool. We want to thank
it's really
new...
not funny.
Why don't you welcome our new TheraPal? That'll cheer you up.
Oh yeah, sorry. I was moving around on my screens.
I'll do it.
Glitched Scoop.
There it
Welcome
is.
to the party.
Thanks for joining us. And of course, we want to thank our bosses, the Saccharin 16, the mysterious and shrouded Illuminati members of the fan club, those Thera producers. Thank you, Smitty Scoop, Jake Schneider, Robert Brownie Jr. Mint, Kayla Lansbury, Judy Schneider, Nathan's Hot Dog Scoop, King of Student Loan Debt, Dr. Ben Don, Crazy Banana Scoop, Mason Miller, Carolyn Albert, Leon Kassab, Kevin Chamberlain, Malia, Richard Macy, Cindy Ash, Newstick, Lord Colin Stewart, Dirty B, Ben Stanley, Sammy Scoop, and Sarah Smith.
And if you'd like to do this episode uncut and unedited,
Why wouldn't you?
and enjoy our spontaneous side projects, go to patreon.com/therapy. And thank you for supporting mental health.
That's all the time that we have for this week's session. We want to thank our landlords, Matt Mattingly's Ice Cream Social Podcast, and again remind you to find the water.
Find it.
Find it. What is it called? The water what?
Water
Shutoff valve.
Water shutoff valve. Mine was in the garage. Okay, you got to hunt that sumbitch down because you might need it. Also, check us out. Facebook.com/PodTherapy, Twitter @PodTherapyGuys, Instagram @PodTherapyGuys, Patreon.com/therapy.
Do you want to submit a question to the show? Ask anonymously at podtherapy.net or email us at podtherapyguys@gmail.com. I'm Nick Tangeman.
It's a me, Mario.
Thanks, and we'll see you for your appointment next week.
You guys don't play Mario Brothers?
Poor Nick.
It's good. I know, it's rough.
I quit playing Mario Brothers before they got the voices. Before they started talking.
Back when it was just sound effect. Donna.
Last Mario I played was Mario 3.
Ooh, that's a good one, though.
I really liked Super Mario World for the Super Nintendo.
Oh, yeah, the SNES. That's easily the best one.
That's a really good one.
That is the
I never
best.
played that one.
Mario 3 is great though.